Burnout, a word that has found its way into the heart of modern workplaces, especially within healthcare. In recent years, the toll of burnout on nurses has reached alarming heights, touching lives and shaping the future of patient care. It's not just a buzzword, it's a reality faced by nearly half of all healthcare workers, as reported by the CDC in 2022. This marks a significant jump from 32% in 2018, showing how the pressures of the profession have intensified, especially in the wake of a global pandemic. Nurse burnout isn't simply about feeling tired after a long shift. It's a persistent state of emotional, physical, and mental exhaustion, driven by relentless demands, high-stakes decision-making, and the constant need to support others. The consequences ripple far beyond the individual, affecting patient safety and care quality. A comprehensive 2024 study published in JAMA Network Open, analyzing data from 85 studies and nearly 290,000 nurses, found direct links between burnout and negative patient outcomes, more frequent medication errors, lower patient satisfaction, and ultimately a strain on the entire healthcare system. Yet, within this challenging landscape, stories of resilience shine through. One such story is that of Andrea Dalzell, the first wheelchair-using registered nurse in New York State. Andrea's journey is nothing short of inspiring. Diagnosed with transverse myelitis at a young age, Andrea navigated a world that often underestimated her abilities. Her determination led her to nursing, a profession where compassion, adaptability, and grit are daily requirements. When the COVID-19 pandemic swept through New York, Andrea was called to the front lines in the ICU. She faced not only the chaos and uncertainty of the pandemic, but also the very real barriers that come with being a nurse with a disability. Her presence in the ICU became a symbol of hope, not just for her patients, but for her colleagues and the wider community. Andrea advocated fiercely for disabled healthcare workers, challenging systems to be more inclusive and supportive. Her story reminds us that resilience is not about avoiding hardship, but about facing it head-on and transforming adversity into action. As burnout continues to loom over healthcare, what can be done to turn the tide? Recent research offers promising strategies. An umbrella review of 131 studies points to interventions such as mindfulness-based stress reduction, resilience and cognition training, and stress management techniques like yoga. These practices empower nurses to better manage stress, preserve their mental well-being, and maintain high standards of care. But individual efforts alone are not enough. Organizational support is crucial. Workplaces must foster environments where nurses feel safe, valued, and heard. Involving nurses in decision-making processes, implementing wellness programs, and encouraging open dialogue about mental health can make a profound difference. When nurses are supported at every level, from their teams to hospital administrations, they are more likely to stay resilient, engaged, and fulfilled in their roles. Andrea Dalzell's journey stands as a testament to what is possible when individuals and organizations come together to confront challenges. Her advocacy has inspired changes that ripple across healthcare, encouraging leaders to prioritize the well-being and inclusivity of their workforce. Her story, paired with recent research and growing awareness, sparks hope for a future where burnout is not an inevitable fate, but a challenge that can be met with courage, and collaboration. For every nurse on the floor, every healthcare worker feeling the strain, and every leader seeking solutions, Andrea's experience is a reminder. Resilience can be cultivated, support can be strengthened, and together, burnout can be beaten. The path forward lies in understanding the realities, embracing proven strategies, and drawing inspiration from those who have walked through the fire and emerged stronger.